The recent surge in cases is again concerning frontline workers who are now taking care of more patients in Dane County than ever before. Adam Dexter and photojournalist Brian Mesmer were given a look inside UW Hospital's COVID care this week and bring you the plea two nurses are making tonight.
Since June, UW Health nurse Andrea Romer has been taking on a task unlike any she's done before.
What we weren't prepared for is how lonely and scared patients can be when they can't have their loved ones visit.
She says at this point, the team taking care of COVID patients in the Trauma and Life Support Center runs like a well-oiled machine. But the virus is still presenting issues even the best frontline workers have a difficult time figuring out.
COVID always takes a different course than what we think, and that makes it so unpredictable. And then we can't always guide the family in what to expect, guide the patient in what to expect. We just kind of have to take it day by day.
What do you need me to grab?
These days, healthcare workers are seeing a second wave of patients, forcing UW Health to effectively double the space they're using for critical care.
Is this going to get worse? You know, like, how are we going to take care of everybody? You know, we're spread out thin as it is. Like, where are we moving next to open another one? How are we going to get the staff to staff it?
Carrie Elwood has been here for 20 years. Normally, she loves making a connection with her patients, but the one she's seeing now can't talk. Both nurses say this process can be incredibly lonely for the patient and them too.
We don't necessarily know what this will look like in the future, how long this will impact us as far as our emotional health.
But as things get worse inside these walls, both frontline workers say they're frustrated by what they're seeing from people outside.
When I have to go out for groceries, I see people walking without their masks on, and it makes me very angry and upset and sad because I see what, you know, happens. It's crazy how they want to, you know, have football games and have, you know, big rallies and all this kind of stuff, but, you know, we're struggling, and it seems like nobody cares.
This means sacrifices.
We're not planning our holiday traditions normally.
And more unknowns.
If we're going to get more patients than we already have, and what's the next step, and, you know, where are we going to get the staff to staff that?
And while they work harder than ever, these nurses know there's only so much they can do. And that's why they're asking you to do what you can do and what we've proven we can do together before.
When we ask people to use more PPE in the community, we really do mean that from a place of we're all in this together and that we're all experiencing this as humans together. And so the more they can do for us, the more we can do for them.
In Madison, Adam Dexter, News 3 Now.
Both nurses say they've learned over the course of the last 8 months that masks and PPE do make a difference. For more on our visit inside UW Hospital, including what doctors have to say about the future of the virus, you can go to our website, channel3000.com.